In a sample of joint fluid of a gout disease, these needle-shaped pretty uric acid crystals can be seen under a microscope. Gout is more common in people with a genetic predisposition to seafood, animal protein, and alcohol consumption. That's why gout was known as the disease of kings, or the disease of the rich in the past, when food was not so easy to access. It causes redness and swelling, especially around the first toe joint. Sometimes, when left untreated, recurrent attacks can cause the accumulation of uric acid crystals in the joint, as in the photo you see. This is not a pretty condition as the uric acid crystals we saw under the microscope. I can hear you saying that you have given up on being king. In this video, we will talk about gout disease. Hello, I am Dr. Gürkan. I am an orthopedic surgeon. This video will explain gout disease and the latest treatment methods. Do you know that gout is one of the most common inflammatory arthritis in the world? Its rate is 2 to 4%. This disease was first documented in Egyptian written documents around 1200 BC. It has been known as an inflammatory condition of the big toe ever since. The incidence increases with aging. It is more common over the age of 40 and is 3 times more common in men than in women. Due to the decrease in estrogen levels, the incidence is the same in postmenopausal women as in men. Let me give a note from the history again. Hippocrates' work Aphorisms in 400 BC drew attention to the fact that this disease is not seen in castrated men and women before menopause. It accompanies obesity, hypertension, coronary artery disease, diabetes, or metabolic diseases. High uric acid levels and blood tests are thought to be associated with gout among patients and physicians. However, it is more complicated than it is believed to be. It is not easy to talk about a gout disease only by looking at a high blood uric acid level in the laboratory test. When arthritis is mentioned, a wide range of diseases with pain and inflammation of the joint comes to mind. Osteoarthritis refers to age-related cartilage wear. However, rheumatoid arthritis is an autoimmune disease. It refers to the joint inflammation created by the host immune system with a false warning against the patient's healthy cartilage. Like rheumatoid arthritis, gouty arthritis is an autoimmune disease. In gouty arthritis, monosodium urate crystals accumulate in the joint due to the increased blood uric acid level. An elevated uric acid level in the laboratory test does not mean gout. Moreover, the accumulation of uric acid crystals in the joint does not mean gout either. A study showed 36% of patients with high serum uric acid levels had been shown with ultrasound that uric acid crystals accumulate in the great toe joint. However, they didn't have any complaints. Moreover, those individuals do not have gout symptoms, such as swelling in the joint and destruction of the articular cartilage. So, what is gouty arthritis? If these crystals accumulate in the joint, the body's immune system may sometimes perceive it as a threat signal. In this case, a very complex inflammatory process is initiated. This process itself is called gouty arthritis. Let's start from the very beginning. You might ask, where do these uric acid crystals in the blood come from? When we consume foods, we also take DNA and RNA, which are the genetic code of these foods. Uric acid is formed by breaking down chemicals called purine in the DNA and RNA structure. Purine is found in high amounts in seafood, meat, and meat products, especially liver and kidney, and in lesser amounts in plant foods. This byproduct, which we take with food, is excreted from the kidneys through urine. Increased uric acid in the blood after a high animal protein intake may crystallize in the joints. By aging, it becomes more difficult to excrete uric acid from the body due to decreased kidney function. Therefore, this problem is seen at higher rates in older ages. The patients usually consult a doctor with sudden onset of pain, redness, and swelling of a joint or multiple joints. They typically notice pain at night, without any trauma, or more often when they wake up in the morning. It is typical for the complaints spontaneously regress and resolves within 7 to 14 days. After the complaints-free and comfortable periods, the attacks start again. It is generally seen around the great toe, which joints with the first metatarsal bone. But it also concerns large joints, such as the knee, wrist, and ankle, indicating a systemic disorder of the body. Fatigue and malaise with fever are widespread complaints during a gout attack. Fever usually occurs when more than one joint is involved. Redness and swelling around the joint can easily be misdiagnosed as a bacterial skin infection, namely cellulitis. During my orthopedic practice, I saw many patients diagnosed with cellulitis and had been started antibiotic treatment. However, cellulitis is a severe skin infection caused by bacteria, as seen here. Later, these patients were diagnosed with gout. In gout, these uric acid crystals accumulate in the joints and soft tissues if recurrent attacks are not prevented. These accumulations are called tofus. In addition, each episode causes damage to the articular cartilage and surrounding bones. If recurrent gout attacks are not prevented, the cartilage damage that has already occurred is irreversible. Some people with gout may also develop other health problems, such as severe arthritis, kidney stones, and heart disease. It is known that gout is related to a familial predisposition. 65% are inherited. 20% of patients have a relative with gout. This information is critical to understanding why not every fish or steak eater gets gout. The disease should be suspected with the specific joint location and typical duration of the episodes. A high uric acid level in blood tests is helpful, but does not make a diagnosis itself. X-ray, ultrasound, and MR images of the involved joints are helpful. Finally, if the joint fluid is aspirated, uric acid crystal accumulation is observed under the microscope. Oral anti-inflammatory drugs shorten the duration of an acute attack. Like other rheumatic diseases, a drug, called colchicine, reduces the severity of inflammation. Steroids can be used in the treatment. None of the medications I have listed here are doctor's advice. I just stated that they are used in this disease. Do not take any medicine without consulting your doctor. On the other hand, I would like to make a few suggestions you can consider as a doctor's advice. First of all, avoid alcohol and carbonated drinks containing fructose. Drink plenty of water. Rest your joints with pain and swelling by keeping them elevated. This prevents further damage to the joint. You can apply an ice pack to your inflamed joints. Don't forget to wrap the ice pack with a towel for not to cause cold damage to the skin. After the acute attack is resolved and the diagnosis is clarified, drugs that reduce the blood uric acid level are used. They can prevent subsequent attacks. In other words, you will need to apply protective methods to prevent new attacks and joint damage during the healthy period when you think you have recovered. Relying on drugs alone is not enough. Changes you can make in your lifestyle help prevent gout attacks that may occur later. Drink plenty of water to help your kidneys work better. Avoid dehydration. Exercise regularly to stay at a healthy weight. Excess weight increases the uric acid in your body and puts more pressure on the joints. Do your best to limit the purine intake in your body. Avoid foods and drinks that contain high levels of purine. The first of these is alcohol. Beer, in particular, triggers gout attacks with its high purine content. Avoid excess red meat and offal, especially liver. All proteins from animal sources can potentially lead to high uric acid levels. Shellfish is one of the most triggering products. Avoid carbonated drinks and foods with high fructose content. Remember, fructose is known as fruit sugar. A 2014 paper examined what triggered the disease in 2,051 gout patients in New Zealand. The most frequently triggered food products were seafood at 63%, alcohol at 47%, red meat at 35%, and tomatoes at 20%. The authors say that food products other than tomatoes are already known. But they were amazed that tomato had such a trigger potential. Some medications can cause high uric acid levels. For example, while diuretic drugs eliminate fluid from the body, they also cause the blood serum to be more concentrated and the uric acid level to increase. If you are using such a drug, warn your doctor. In addition, it is helpful to be vigilant as drugs commonly used to suppress the immune system in organ transplant patients can increase the uric acid level. Losing weight, exercising, and taking vitamin C supplements help. Interestingly, coffee and cherries also reduce the frequency of gout attacks by lowering purine levels. Medical publications state that drugs that lower blood uric acid levels should be addressed instead of trying to solve it with diet alone. I wondered where the name gout etymologically came from. Randolphus of Bocking, around 1200 AD, first used it. It is derived from the Latin word gutta. It means drop and has a meaning such as the drip of a disease-causing substance from the blood around the joints. Interesting. Remember to subscribe and hit the like button if you like this video so that you can see my videos with orthopedics, nutrition, and sports content. May you live like kings but never meet the king's disease, gout.